I would now like to introduce you to Stephen Hall. Stephen is a registered nurse and a doctoral student at the University of Alberta. He completed his master's in nursing in 2023 at the University of Saskatchewan. Steve is going to first explain about how the Padlet works and how we can use it, followed by the findings from the Saskatchewan Caregiver Experience Study and implications for policy.
All right, thanks, June, for the introduction. Like June said, my name is Stephen Hall. I'm a registered nurse and doctoral student at the University of Alberta. It's my pleasure to share with you today the findings from my research, the Saskatchewan Caregiver Experience Study. So first, I'm going to talk a little bit about the study, and then we're going to go into the policy recommendations that have arisen from the study's findings. There's a global push towards promoting positive aging in the community, which can also be referred to as aging in place. Canada's population is aging, and that's no different in Saskatchewan. 16% of Saskatchewan's population is made up of older adults over the age of 65. And although this study was not exclusive to caregiving and dementia, just as an example, there's an estimated 19,000 older adults living with dementia in Saskatchewan, all of whom would rely on family and friend caregivers. So the purpose of the Saskatchewan Caregiver Experience Study was to map the experiences and perspectives of caregivers in Saskatchewan and identify their priority support needs. So let's talk a little bit about how this happened. We started by doing our recruitment through Facebook and community newsletters. It was recruited into a qualitative survey that was delivered via SurveyMonkey. There were three open-ended questions on the survey. They included, what do you find most challenging about being a caregiver? What do you find is positive about your caregiving role? And what do you find is most important for support in your caregiving role? So the results. We were lucky enough to have 355 participants from across Saskatchewan with a mean age of 61 participate in the study. These 355 caregivers cared for 396 care recipients with a mean age of 83. The geography of the participants was actually very interesting. It was evenly split amongst urban large, urban small medium, and rural communities. And because we collected the first three characters of the postal codes of our participants, we were able to generate this map that shows where all of our participants were throughout the province. So it was really interesting. We were able to reach basically all corners of the province. The findings from the study. This is the concept map of the findings. So first of all, the challenges. Caregiver participants found that caregiving is exhausting. They found trouble finding time to live their own life, as well as navigating complex health and social systems. There's often self-doubt, and so they were often asking themselves, am I doing it right? As well, unique to Saskatchewan, caregiving at a distance was a challenge because of our wide geographic spread. Positive aspects of caregiving. Many caregivers found it rewarding. They were honored to have the ability and opportunity to care. They liked being in the know and ensuring quality care for their care recipients. They also found a level of personal growth through being a caregiver. And there were some participants who responded saying that caregiving is not a positive experience for them. Lastly, their support priorities. They prioritize help when we need it, an ear to listen and a shoulder to lean on, optimizing the care recipient's health, healthcare professionals that care, and improved policies, legislations, and regulations. So today we're going to be talking about the policy recommendations that have risen from the Saskatchewan Caregiver Experience Study. And just a reminder, you can use the QR code at the bottom right-hand corner to scan and throw up your thoughts on the Padlet board, which we'll look at after this presentation. So here's the overview of the policy recommendations that we're making. These slides will also be circulated after the webinar if you'd like to request them through June and her emails at the end of this presentation as well. It's important to note that there's a lot of overlap in the rural and urban caregiver needs, and many of these policy recommendations under each category can be adapted for each setting. But they are merely sorted in a way today that was based on the data that was provided in the study. Since data was collected from both urban and rural participants, we are going to go through each of the resulting policy recommendations by geographic setting, and we'll start with rural first. As we go through the policy recommendations, you'll notice a yellow star next to some of the implementation strategies. These are strategies that SCOA is well positioned to address with additional funding to the Caregiver Center and its initiatives. So like I said to begin, the rural policy recommendations. The first one that is might seem obvious is to strengthen the home care workforce. One of our participants said, increasing support for home care in rural areas, recognizing the challenges of recruitment and retention. Private home care is based in larger centers. Often when the caregiver is needing a break, it requires the one requiring care to have to go into a facility, respite, which often initiates a break in the routine and causes agitation with someone who has dementia. Sometimes it's easier just to provide all the care rather than change the surroundings, routine, and the needs of the person who needs care. Another participant said, lack of home care services in rural, resulting in those that require care needing to be relocated to large, unfamiliar locations. No support to have a parent move in with family due to lack of staff in rural. Childcare costs are $35 to $45 a day, but to hire a private care provider for older adults is $36 an hour. So the policy action we're recommending to strengthen the home care workforce is to increase funding for rural home care services to expand their reach and ensure caregivers can rely on the professional support in their communities. Implementation strategies. Resources are needed for daily tasks such as meal prep, hygiene assistance, and medication management. We're suggesting to consider incentivizing home care agencies as well as organizations that provide assistance with these daily tasks to prioritize rural areas by offering tax rebates and direct subsidies. Improving access to healthcare and transportation was also important in rural settings. One participant said, we live in a small town with no pharmacy, doctor, or care facility. When my mom was in the hospital and later my dad in care, the number of miles I put on was horrendous. There was no one to call here, and every health challenge had to be dealt with an hour away. Another participant said, small towns need to be able to retain staff in the healthcare facilities that already exist. It's more than inconvenient to drive 1.5 hours for emergency care. It is very hard on the person with dementia. So this was a caregiver to someone with dementia as well. So the policy action, strengthen rural healthcare infrastructure and reduce the burden of travel on caregivers. Some implementation strategies. Expanding telehealth services with specialized support for dementia care, mental health counseling, and routine health checkups. And SCOA is positioned to help with the positioned to assist with the mental health counseling through the Caregiver Support Information Support Center with their registered social worker team members. Mobile medical mobile units. Currently, in some rural areas, paramedics are allowed to collect blood samples, but expanding the scope of practice and encouraging organizations to support programming to carry out these consults in rural areas would be incredibly beneficial to those who struggle with transporting their care recipients to urban areas for these services. And lastly, expanding and subsidizing non-emergency medical transport services for caregivers and their care recipients. Currently, there's a shortage of paramedics and ambulances across the province. We often hear about ambulances being stuck in emergency departments waiting to offload their patients, while many other individuals struggle to receive critical care in rural areas in the periphery with lack of ambulances. Expanding, subsidizing, and incentivizing organizations to commit to non-emergency medical transport would benefit caregivers and their care recipients immensely so that caregivers are not taxed with the burden of transportation to urban centers, and neither are the paramedics. Addressing rural long-term rural long-term care challenges. A participant had said improvement in senior accommodations, i.e., nursing homes and the levels they accept. The fear of not having an opening in a nursing home in her community, and she would have to be placed in a home in another community and or health region or area. Another participant said, my mother fell at home and was admitted to a local ER, but transferred to a hospital 1 hour away due to lack of beds. Spent 4 days there, transferred to the city for investigation and tests, then transferred to home hospital, which was 2 hours from her home due to lack of beds. 3 weeks later, transferred to the fourth choice on her list for long-term care. Spent 3 weeks and then transferred to her final long-term care facility in her home. She was in 5 institutions, 6 ambulance trips in 7 weeks. Meanwhile, as a caregiver, I had to drive to all these different facilities every 2 days at great financial and personal fatigue costs. So the policy action we're suggesting to address rural long-term care challenges is to improve quality and access to long-term care in rural communities, which is obviously a big ask. But quality is so if some implementation strategies we have to suggest are for quality, funding training programs for rural LTC to learn more about dementia care, palliative care, and other types of specialized care. And SCOA is positioned to help with this because SCOA supports the development of training programs with and for older adults through collaborations with the University of Saskatchewan and researchers there. Access, prioritizing the enhancement of a centralized LTC placement system to match rural residents with facilities efficiently. We understand that there's currently a centralized LTC placement system within the SHA, but the access to rural areas are still limited. With the previous recommendation of incentivizing home care and long-term care organizations to develop in rural areas, this would enhance the ability for rural residents to be matched to LTC in their communities, close to their support system and caregivers. And lastly, funding organizations that can provide additional support in LTC, such as companionship programs and activity facilitation. SCOA is involved with many of these, such as NavCare, the Telephone Buddy Program, the Pen Pal Program, and many more. These are currently in the Saskatchewan community and surrounding areas, but this is only due to SCOA's current capacity. These programs are easily transferable to LTC settings with more financial support. Establishing a rural caregiving task force. Some quotes from participants included, I feel like there needs to be a way for caregivers to know what services are available regarding home care or other services and how to go about accessing them. So many times, I feel like we are blindly navigating the healthcare system, and this greatly adds to the stress of our situation. Another participant said, a task force could help navigate and implement changes that consider caregivers and seniors' needs. So the policy action we are suggesting is to establish a provincial task force to address rural caregiving challenges. This includes strategies such as forming an interdisciplinary team of caregivers, healthcare professionals, and policymakers to review and recommend changes. To continue to survey the needs of rural caregivers, much like this study did, to identify emerging needs and gaps in services. And lastly, to ensure caregiver representation in health policy planning and resource allocation. SCOA has a dedicated caregiver committee with SCOA team members and community volunteers who are all eager and passionate about supporting caregivers. These committee members are also well positioned to participate in a caregiving task force like this. A community of caregivers that can use their voice to contribute thoughtfully and meaningfully with their lived experience. Now to move on to the urban policy recommendations. The first was to increase affordable respite care services. Uh, the participant quotes included, having someone to provide respite would be a huge help, even just for a short period. I would prioritize respite care for a few hours so I could leave and know everything was okay. And lastly, respite or a way to have someone to take the patient for an outing or companionable visit for enrichment to allow the caregiver some time for their own needs and wants. So the policy action we're suggesting is to expand respite care availability to caregivers to prevent necessary burnouts, to provide necessary breaks and prevent burnout. The implementation strategies we suggest are to introduce funded respite care programs with a sliding fee scale based on income, establish drop-in day programs for care recipients, and create a caregiver relief fund to subsidize private in-home respite for low-income caregivers. Next, we suggest expanding the workplace support for caregivers. A participant said, there is not enough legislation that allows for long-term caregivers the understanding and acceptance they need. Familial accommodations in the workplace can be done when young families are having difficulty accessing daycares or etc. But when you're caring for an older adult, the patience or tolerance is not the same. So the policy action we're suggesting is to introduce job protection for caregivers of older adults. This could include creating employment protections for caregivers to ensure flexible work schedules, promote remote options where possible for employees to attend to their caregiving responsibilities, and offer subsidies for businesses to implement caregiver employee assistance programs to offer counseling, navigation resources, and others. And SCOA is positioned to develop employee assistance programs with navigation resources and advocate for caregivers to employers. Address LTC staffing shortages. Long-term care staff generally are doing the best they can, but are short-staffed often. Another participant said, there is a need for affordable, safe, kind, caring, and sufficiently staffed facilities. And lastly, a participant said, I believe there should be more funding of seniors care in the province. I believe there are not enough staff in these homes to properly care for the elderly. So the policy action we're suggesting is to incentivize healthcare professionals to work in urban long-term care and home care. Currently, there is student loan forgiveness for healthcare professionals that are new grads that want to work rurally, but we're suggesting that you could introduce student loan forgiveness programs for healthcare workers committing to long-term care facilities in urban centers, and creating fast-track training programs for healthcare aides specializing in elder care. Advocacy and public awareness campaigns. Caregivers require the respect and support of the healthcare system. By supporting caregivers, we are improving patient care. And another quote, more advocacy and someone to explain and take the time to assist seniors to better understand medical appointments, treatments, and medications. And finally, another quote, there needs to be clear and standard rules about including and informing family or chosen support persons. We so often get lost or misunderstood. We should not have to fight to be part of our loved one's care team. The policy action we're suggesting is to raise awareness about caregiving challenges and available supports. And the implementation strategies include funding public education programs about caregiving resources, including workshops and seminars, much like the ones that SCOA already delivers, and support the SCOA and the Saskatchewan Caregiver Information and Support Program, Support Center, in recognizing caregiver contributions during the annual Provincial Caregiver Appreciation Week in April. Improving navigation of health and social systems was the last one that we had, I think. So the quotes from the participants were, there are lots of services, but you're on your own for coordinating it all. The geriatric assessment unit at City Hospital in Saskatoon was good, but they just give you a long list of here is what you need to do. Bye-bye. Help, but not particularly helpful. It's great to have the input, but it's getting all the stuff done that's challenging and exhausting. Another quote was, finding resources for them and knowing how to navigate the systems, always digging for what is needed, haven't found anything easy. The policy action is to centralize caregiving assistance to access information and resources. The implementation strategy is to support a one-stop caregiving shop to provide guidance on caregiving activities. And an example of this is the Saskatoon Caregiver Information and Support Center. There are caregiver navigators at the SCISC, and they also already run a caregiving support helpline, which the number is on the screen here. It's 1-888-652-4411. So thanks so much for joining me for this presentation today. For more information about the Saskatchewan Caregiver Experience Study, we have 4 journal publications. You can scan the QR code on the left-hand side of your screen to access these publications in a Google Drive folder. And I'll pass it back to June.
Thank you, Steve, for that amazing presentation. I would now invite Jennifer White to say a few words about the Caregiver Information Center that we have.
Good morning, everyone. It's an honor to speak with you all today on behalf of the Caregiver Information and Support Center, which is a program of the Saskatoon Council on Aging. At the Caregiver Information and Support Center, we are committed to supporting family and friend caregivers across Saskatchewan who play an indispensable role in our communities. As we've heard from Steve, the challenges facing caregivers are vast and they are growing. As our population ages, more of us will inevitably step into caregiving roles. It's not really a matter of if we will become caregivers, but when. And when that time comes, we need to be sure that caregivers are not left to shoulder this emotional, physical, and financial burden alone. The Saskatchewan Caregiver Experience Study paints a clear picture of the issues that caregivers are facing today. The study highlights the critical areas where change is needed, areas that Steve just outlined, from strengthening support services in rural communities to improving access to healthcare and respite options. But what's clear is that action is required at every level: community, healthcare, and government. The recommendations discussed here today are a vital part of the solution, and they reflect urgent need for a more coordinated, supportive caregiving system, whether it's improving access to professional care, increasing workplace protections for caregivers, or enhancing public awareness. There's a lot of work that still needs to be done. But the question remains, how do we move forward from here? And this might be the kind of question that you'd like to pose on the Padlet. But the answer lies in collaboration. It's not just about recognizing the importance of caregivers, it's about creating a system that truly supports them, a system that ensures they have the resources, the information, and the breaks that they need to provide care without burning out. A system that values caregiving as the essential work that it truly is. These are not just policy issues. These are issues that impact real people, families, and communities. And the solutions are within our reach if we work together. So I urge all of us to take action. Whether you're a caregiver, a healthcare professional, a community leader, or a policymaker, ask yourself, what can I do today to make caregiving more supportive, more sustainable, and more valued? The caregiving journey will touch each of us, whether directly or through those that we love. And when that time comes, let's ensure that we've built a system that's ready to support every caregiver in Saskatchewan. And finally, I would like to take a moment to offer a heartfelt thank you to Stephen Hall for his outstanding work. His dedication and leadership in bringing attention to the challenges that caregivers face has been invaluable, and we are grateful for his ongoing commitment to improving the lives of caregivers in our province. So thank you, Steve, and thank you all for your time and attention and support. If you'd like to learn more about the Caregiver Information and Support Center or the Saskatoon Council on Aging, you can reach out to our Executive Director, June Gowden, at june@scoa.ca. And with that said, I will now pass it back to you, June. Thank you.